Hi there. Welcome to Anonymity 1D. My name is Susan. My daughter Mia has type 1 diabetes.
My name is Lisa. I am a diabetes educator and also have type 1.
Hi, my name is Kaajal, and I'm a type 1 diabetic. I'm a wellness entrepreneur and diabetes advocate.
In this video, we meet Kaajal, my good friend from Zambia, learn about her life and experience with type 1 diabetes. Together we talk about the symptoms of type 1 diabetes and why they happen.
Please remember that this is for informational purposes only and is not meant to replace your doctor or care team.
Let us know what you think about this video. Don't forget to like and subscribe to our YouTube channel. Also check out Kaajal on Instagram at dia.bts.by.kc. Thank you.
Hi Kaajal. I want to introduce you to my friend Susan and her daughter, Mia. Mia has type 1 diabetes too.
Kaajal, nice to meet you. Hope you had a comfortable flight. How do you know Lisa?
Lisa and I have been collaborating on different projects. I am so glad I finally got to meet her in person.
Kaajal, why don't you tell them a little about yourself?
A little bit about myself. Where shall I start? Well, I am the youngest of 5. I have 3 brothers and 1 sister. My family are from Zambia, but we are South Asian by ethnicity. We've been in Africa for over 3 generations. I guess we all loved growing up in the sun.
Oh wow! You have so many siblings.
I know, we're such a big family. But actually, growing up, it was just me and my parents. My brothers and sister went to boarding school.
Mom, what's boarding school?
It's when you go far away for school. Sometimes parents send kids there so they can learn life skills on their own and in their own way. Kaajal, why didn't you go to boarding school? Was it because of your diabetes?
You are absolutely right, Susan. At that time, we didn't have much information in Zambia around diabetes. My parents didn't feel comfortable with me going so far away without their guidance.
How old were you when you were first diagnosed?
I was just 5 years old.
You were younger than me. How did they know you had type 1?
Why don't we start prepping for the picnic in the kitchen and continue this conversation over there?
My mom saw that I was losing a lot of weight. When she dressed me for school, my underwear would just drop off. I wasn't always a happy chappy and was really clingy to her. My mom used to wear saris a lot in the 90s, and I'd hold onto her sari trail whenever I could because it felt like my comfort blanket. She also noticed I was wetting the bed a lot at night. These were some signs that something was going on with my health.
Mom, how did you know I had type 1?
Mia, just like Kaajal, you were also clingy and started wetting the bed again. You were drinking a lot and peeing a lot too. You were too tired to even play with your friends. You started vomiting, so we took you into the hospital. They found that you had lost a lot of weight and needed to keep you there overnight.
Why did Kaajal and I have different symptoms when we were diagnosed?
I can help you understand that. We know that in type 1 diabetes, the body does not make enough insulin. As we eat carbs like the apple in this example, the body breaks it down to glucose. But there is not enough insulin to send the glucose into the cells. This leads to the glucose level rising in our blood. The body starts sensing that the blood sugar is high, but does not know why it is happening. In the hope of flushing out the high sugar, it makes us thirsty. So, you start drinking a lot and peeing a lot, sometimes to the point of wetting the bed at night. In the meantime, the cells don't know that glucose is right outside the door. All they know is there is no energy coming in. They think you are starving, so they increase appetite to make you get more calories. So oftentimes, the first few symptoms of type 1 diabetes can be very subtle.
That makes sense. How about we continue this conversation at the park over our picnic lunch?
Let's go.
In hot countries, it might be harder to recognize some symptoms of type 1 diabetes. Because it's so hot, people drink a lot of water to stay hydrated. Thirst, like Lisa mentioned, is a symptom of diabetes. But when you drink a lot of water, you need to pee a lot too. Another symptom of diabetes. So it can be tricky to diagnose early because these signs might seem normal. Another big symptom is mood swings. I was really tired and irritable when I was diagnosed, probably because my cells weren't getting the energy they needed.
That makes sense. What causes the weight loss?
I can explain that. Once our body realizes that the cells are not getting glucose, it releases stress hormones that breaks down protein and fat stores for energy. As you do that, you start losing weight.
Why was I vomiting? Why did I need to stay at the hospital?
That's because of ketones. As we are not able to use glucose, the body starts breaking down fat for energy. When we do that, we make ketones. This is what makes us feel sick. To recap, if you don't have enough insulin, like when we are diagnosed, the blood sugar starts rising, causing us to drink a lot and pee a lot, like what happened with Kaajal and you. Because the cells don't get energy, we feel tired. The body taps into our reserve for energy, causing weight loss. Through all of this, we make ketones, which can cause nausea, vomiting, rapid breathing, and can make you feel so tired that you may pass out.
That sounds a lot like how Mia was when she was diagnosed.
My mom told me I was irritable and I didn't want to play with my cousins. She took me to the clinic, but they couldn't diagnose me straight away because my diabetes was in a honeymoon phase.
What's that?
Okay, Mia, let me explain it. It's like your body is making some insulin, but not enough. So when the doctors did their tests, everything seemed fine. But my mom knew something wasn't right with how I was acting every day. It's like the diabetes was hiding and getting ready to show itself. After about a month, the doctors were able to diagnose me for real.
So people can have different symptoms for type 1 diabetes when they are diagnosed, like Kaajal and I?
That's right. The symptoms may be subtle, like drinking a lot and peeing a lot, or more serious, like feeling nauseous, vomiting, and feeling so tired that you pass out.
And Kaajal was younger than me when she was diagnosed.
So, as we can see, type 1 diabetes often happens at a really young age. That's why it was originally called juvenile diabetes. But you can be diagnosed even as an adult, which is why we don't call it juvenile diabetes anymore. And it's not because we ate too many sweets, it's an autoimmune condition where the body suddenly attacks itself. When this happens, we see different symptoms. Until we start talking more about this, we can't always be sure if someone has diabetes or not. By having more knowledge about it, we can go and get screened early, and this can help us avoid rushing to the hospital when we're really sick.
We hope this gave you a better understanding of the range of symptoms that you can see with type 1 diabetes and the reason for them. And also that type 1 can present at any age.
Please remember that this is for informational purposes only and is not meant to replace your doctor or care team.
Let us know in the comments your thoughts about this video. Check out Kaajal's Instagram channel where she posts lots of cool tips and valuable information about living with type 1. Don't forget to like and subscribe to our channel. Thank you for watching.